Morning, everybody. Good morning. Is this not a beautiful day for a celebration? And we are truly, truly celebrating. And it is not just celebrating the addition of this clinic, but really enhancing our access to care and how we grow stronger in the community. So number one, thank you very much for coming out today and celebrating this great, great thing with us as we move forward. So I, number one, wanted to express my gratitude to Governor Martinez and Lieutenant Governor Sanchez, because really when I got here in 2012, I identified the shortage. We are a health provider shortage area. There are only 6 providers at that time serving this entire northeastern area. So we really saw a need to improve access to care. And what we did, we sat down and designed what we knew we had to build was a new primary care clinic. And how we got that funding is how Governor Martinez and Lieutenant Governor Sanchez helped us. We went before the New Mexico Finance Authority and talked with them about our needs. And they approved as we refinanced our bonds that paid for this hospital, and we were able to take out an additional $3.2 million to build the clinic you're going to see in a few minutes. So they were instrumental in helping us in that process. We also were able to save well over $1.6 million in that refinancing. So again, making sure we're financially strong. So we have some wonderful representatives also with us today who have been tremendous partners in supporting not only Miners Colfax Medical Center, but this entire region. And for Senator Udall, I have Matt Miller. For Senator Heinrich, I have Paul Heidel. For Congressman Ben Ray Lujan, we have Stephen Salas. For Michelle Lujan Grisham, she has provided a letter we'll read later. And then, of course, we have our tremendous partner and Representative Dennis Roche. So with that, Matt, would you like to come up and say a few words?
Good morning. Good morning. I know it's not nearly as exciting having staff show up in lieu of the boss, but he was, due to a hectic schedule, was not able to make it up here this morning, but did ask that I read a statement from him to all of you. Thank you for inviting me to share a few thoughts with you this morning. I'm very honored to join you in celebrating the opening of Miners Colfax Medical Center's new rural health clinic. I want to begin by thanking Administrator Sean Lurch and the staff and board of Miners Colfax Medical Center. You saw the need in Raton and Colfax County for greater access to primary care and brought this project in ahead of schedule and under budget, something you should all be very proud of. I'd also like to thank Architect, Design Group, and Hawkins Construction, who built this beautiful facility you're about to see. This clinic is a wonderful example of Miners Colfax's commitment to quality health care for our rural communities. By putting pediatrics, family medicine, internal medicine, gerontology, and OB/GYN services all under one roof, you're offering a wider, deeper range of services for as many as 25,000 rural residents who rely on you for their care. And good health care is not just about treating illness. Expanding your breadth of services shows you're serious about the importance of health promotion, disease prevention, and early detection. In addition, this rural health clinic will benefit the local economy. Healthcare is one of America's fastest growing industries, and by creating jobs to deliver vital primary care, you're putting money back into the community and investing in Raton's and New Mexico's future. As a member of the United States Senate, I've strongly supported efforts to improve rural health care. This includes a commitment to expand the healthcare workforce, especially by encouraging students from the community to return home as health providers, support for residency programs at community clinics, telehealth services, loan forgiveness programs, and protecting rural payment rates. I will continue fighting for resources that are important for healthcare in rural areas like Northeast New Mexico. But it's here on the ground that the hard work gets done. And today we see the results of all that hard work. Our rural communities truly are the backbone of our state. I'm grateful that Miners Colfax Medical Center's far-reaching vision has created opportunities for the people of Northeast New Mexico to get the health services they need and bolster Raton's economy at the same time. Thank you and congratulations to all of you for a job well done.
Thank you, Matt, and you represented Senator Udall very well. Do not steal my notes. All right, next, for Senator Heinrich, I'd like Paul to come up.
Thank you, Sean. Good morning, everyone. My name is Paul Heidel on behalf of Senator Martin Heinrich, and I promised Candace that I would keep this to about a half an hour, so no, I'm just kidding. It's a real honor to be here this morning, so I'd just like to read a brief statement from Senator Heinrich. Dear friends, good morning. I am pleased to congratulate Miners Colfax Medical Center and CEO Sean Lurch and Board President Kathy McCleary on the completion of the primary care clinic. This new 11,000 square foot medical center will expand access to high-quality healthcare uniquely tailored to the needs of the community. Additionally, this cutting-edge medical center will implement a variety of educational and community-based programs which will empower individuals and families to lead healthier lives. As the only hospital in this region, the services this clinic will offer will reduce barriers to care, such as long driving distances or health conditions that make travel difficult. I'm very pleased to see the outpouring of support from the city of Raton and northeastern New Mexico. Throughout my tenure in Congress, I have fought to increase access to affordable, high-quality care, and I'm encouraged that this new facility will allow the clinic to increase its caring capacity. The ability to provide more patients with the care they need is particularly important, given that the Medicaid expansion authorized by the Affordable Care Act will create the opportunity for over 130,000 previously uninsured New Mexicans to gain health coverage. Healthcare reform is also expected to bring an estimated $6.2 billion in federal dollars to New Mexico over the next 10 years. Accordingly, I'm very grateful to the staff of Miners Colfax Medical Center for the continued role they play in enhancing public health and the well-being of all New Mexicans. Again, thank you for the opportunity to share a few words with you today, and I commend all the parties involved for your vision, diligence, and hard work in the building of this model healthcare facility. Thank you. Sincerely, Martin Heinrich.
Wonderful, wonderful. Thank you very much. And now for Congressman Ben Ray Lujan. Stephen.
Good morning, everybody. The congressman's sad that he's not here to speak to you guys, but I'm here to read a message on his behalf. Dear friends, I wish that I could be there with you in person today to celebrate the exciting opening of this new rural health clinic. However, I appreciate the opportunity to share a few words and to congratulate you on this wonderful new facility that represents an important step towards improving the health and the well-being of this community. I want to thank all of those who were instrumental in opening of this clinic, folks from Colfax, Miners Colfax Medical Center, as well as the Colfax County and Raton community that has been supportive of this effort from the beginning. The Raton Clinic will become the next facility within the Miners Colfax Medical Center network to serve the community with vital health services. Rural communities too often face a lack of health services as well as higher rates of uninsured individuals. I have been proud to support efforts that strive to ensure that rural communities are not overlooked when it comes to the access to health care close to home. I have supported incentives for doctors that practice in underserved areas so that we can recruit and retain physicians where they are most needed. And I have supported legislation to protect rural hospitals from cuts to the reimbursements that they rely on in return for providing vital health services. Rural communities face unique challenges when it comes to healthcare, but by working together, we can continue to make progress that will improve the health of our friends and neighbors. Finally, thank you to all the staff of Miners Colfax Medical Center and those who will be coming to this new clinic. Their caring touch will heal the body and their friendly service will mend the soul. Thank you for all that you do. Again, congratulations on the opening of this new clinic. Sincerely, Congressman Ben Ray Lujan.
Thank you again, Stephen. Great. And I appreciate the support Congressman Ben Ray has provided to us. Also, and I really want to stress, we have Representative Dennis Rosch here, and he has been a tremendous partner for us. And he really was what I'll say is a pit bull in this last session to make sure we obtained our capital funding, where, as you know, they suspended that And he really did a lot of behind the scenes to get that through, which brought tremendous opportunity for enhanced equipment for us. So I truly appreciate Representative Rosh for being here. Come on up.
Boy, standing in this facility, this is a dream come true, isn't it? And here's the deal, that long before today, long before we're here at a ribbon cutting, a grand opening, the board sort of cast a vision. They had this dream of a facility that would prevent folks having to drive many miles through some pretty rough country and possibly bad weather and over some roads that need some repair to get to healthcare providers. Let's bring them right here. That was the dream. And long before we're here today to celebrate the opening, they started sharing that dream. As Sean said, they took it to the governor, lieutenant governor, they took it to the folks that do the funding, they brought the dream to me. In fact, I've come and sat with Sean and shared the dream about what he wants to see, what the board wants to see here in this facility, and put some of our efforts legislatively behind that dream to make it a reality. And so now, here it is. And so anybody in here ever see that movie Field of Dreams with Kevin Costner? Yeah. So I love that line, right? The whisper that Kevin Costner's character hears, if you build it, they will come, right? And so now we have built it, and we're waiting for them to come. Now, who's coming? Well, Monday morning at 8 o'clock is the first appointment. So we know patients are coming because we know there's a demand that now this is going to help fill. We also know that who else is coming? Healthcare providers. A number of new providers coming on staff right here in Raton and Colfax County, and that's fantastic for patients, but it's also great for the economy. I got, Paul Jenkins sitting right here with Grow Raton, and he and others are trying to build and revitalize our local economy. So having additional professionals working here, sending their kids to school here, buying supplies here in town, right? Shopping at our local businesses. That is a tremendous infusion of local economic activity. And I would argue that who else is going to come as a result? Other businesses. Routinely, education and healthcare access are at the top of the list of things that businesses are looking at when they look for places to relocate or to create a new business. And so I guarantee you, with this new facility, Raton is once again on the map for some serious business recruitment efforts, and I'm going to do everything I can do to help get Raton on the top of those lists for recruiting efforts. So we'll continue to work. Now, what Sean didn't mention is we did all this work to get the capital funding. Now he's actually put a lot of work on my plate because we got to make sure we continue the operational funding to keep things up and running. But absolutely, I remain committed to it. And if there's anything I can do to help, I hope you'll contact me. It's a privilege to represent Raton in the legislature. And it's work like this when everyone comes together, both the board and the staff and the volunteers, to really make this a reality. That is truly an exciting day. Congratulations to you and to all of us for this success. Thanks, Sean.
Appreciate that very much, Representative Rosh.
John, call the ER, please. John, call the ER.
And as we talked about a lot, it did take a lot of vision and commitment at the Board of Trustees level. And today we have Kathy McQuarrie, the board chair, who would like to say a few words.
Welcome, everyone. It is fantastic to see all of you here joining us today on a gorgeous Saturday and a wonderful opportunity for you to view our new facility, one which we know you will use and utilize for years and years to come. One thing about this is it's great that October 6th, 2014, we were just standing outside here digging the first piece of dirt so that this new unit could be added on. Here we are 10 months later and standing right here offering services to you. So again, it's been wonderful to be able to move this project along. And also, I want to make a point. MCMC has been in existence providing resident New Mexico miners and this community and the surrounding area for 109 years. We plan on doing this for 109 more. So this facility that we're currently sitting in was built and utilized, first opened its doors in 2007. So in a short 8 years, we realized the direction of healthcare and the needs of the people and what we need to provide. It's been wonderful bringing in new providers. We're excited to have them and have them on board as a team. You know, on behalf of the Board of Trustees, I'll name them. I don't know if all of them are here. Scott Berry, Dr. Belknap, Raymond Ridarte, he is from Penasco, and Cotton Jarrell, who is from Grants. They're a great team to work with, and it's an honor for me to work with them and provide the visions for healthcare for this community and the resident miners of the state of New Mexico. So also, in parting, I want to thank the MCMC team for all the work they do, for all the effort that they put in and dedication to providing health care to this community and to the surrounding areas. And we look forward to building on what is right and moving forward and providing you with the quality health care you deserve. Thank you for joining us.
Wonderful, Kathy. Thank you very much. As we've talked about originally, you know, we did project or have the budget to finish, and the joke was July 29th at 6 p.m. I was happy to report we did complete the project 2 weeks ahead of schedule and $60,000 under budget. We're very happy with that. But we could not obtain, you know, that great partnership without Doug Majewski and Design Group. Doug, if you could raise your hand. They were the principal architects on this project, along with the Hawkins Group builders, Jeff Hawkins and Steve as construction manager. I didn't see Jeff here today, but truly I appreciate Jeff's partnership as he worked closely with our construction manager, Sam Cerna, to make sure, again, it came in ahead of schedule and under budget. Also, I really want to acknowledge Rhonda Monio here. Rhonda, raise your hand. She is our clinic operations director, and she has done a fantastic job bringing this clinic together in a very short period of time, working with not only all of our wonderful practitioners, but bringing new team members on board and getting them up to speed. And you're gonna really see that exceptional team as you tour around. But can you guys raise your hands? Big round of applause for them. Come on. Along with, you know, the construction, we talked the funding, I really want to say a thank you also to Royal Quint and FNB, where they were our local financial partner and allowing a lot of flexibility, as you know, in construction and ease in access to cash. So I thank Royal for that. Also, as we, thank you. Also, you know, as we look at recruitment and retention, one of the things is to assist in bringing those wonderful practitioners here is providing different types of incentives, from relocation to commitment, those type of things. And I really want to acknowledge the Northeastern New Mexico Medical Community Foundation, who's headed by Paul Kessler, Howard Woodworth, Sharon King, Kirk Davis, Penny Perriettle, and Bob George for their leadership. Thank you. Also in the recruitment was Colfax County, where we have a special recruitment and retention fund they partner with us on, and that is supported through Patricia Gonzalez and her team, but also the County Commission, Bill Saubel, Landon Newton, and Roy Fernandez. Thank you. So today could not happen today, without some wonderful, wonderful team members First and foremost, our maintenance team did an exceptional job organizing, getting things installed, getting the grounds cleaned up and right for everybody. So thank you to the maintenance team. Our housekeepers, as anyone has visited this organization knows how exceptional they are. They keep this facility, both here at long-term care and now the new clinic, in just tip-top shape. And as you know, hospital-acquired or healthcare-acquired infections is an important thing, and they take their job serious to protect you. So thank you to the housekeepers. And I promise at some point you will be able to get out to the food. But the dietary team did put together a fantastic meal today. So thank you to the dietary team for their exceptional work. As we've talked about, healthcare has really evolved, and much of it goes around information technologies. And without our 3 dedicated information technologists, we could not be at a very high level. And we are at a best-in-class facility with the best-in-class information technologies. Thank you to Dick for his leadership and all the IT team. Now, I don't think you could get by without looking around and see some pink around here, can you? No. We have a tremendous Miners Colfax Medical Center auxiliary team. They are committed to providing care and the resources for us to serve you. So without them, we could not be as strong as we are. So thank you to the auxiliary. I also wanted to thank Heather Sintas, who did our living giving tree, and you'll see a board as you walk in of the murals she'll be putting in our new clinic. Just some phenomenal new things, and we truly appreciate Heather, and she is such a talented artist. So as we've talked a little bit also in our partnerships, you know, we are enhancing care not only in our clinic but other areas, and that includes our partnership with Tri-State Care Flight Team. Ed Rue is in the back with his care team, and they're going to be starting here 24/7 very soon. So Ed, thank you for your partnership. So ultimately, we've been talking about our practitioners, how exceptional that team is coming to be in a very collaborative environment. That care team is comprised of advanced expertise to really meet the needs of the community and all the populations we serve from really birth until end of life. So with that, I really want to acknowledge and thank our practitioners who have joined us and are committed to providing that care. They are truly wonderful partners. So Dr. Leonardo Lopez with internal and pediatrics. Dr. Christine Lopez with internal medicine and geriatrics. Dr. Haris Kazmi, pediatrics. Kirsten Adams, nurse practitioner, family medicine. Now, I believe they're working actually right now in the OB department, but Dr. Jessica Roberts and Dr. Luisa Chavez. We've also added in our specialty clinic some wonderful general surgeons, and Dr. Stan Chow, he's back there. And Dr. Angel Wright. So this focused recruitment has not only increased access to care, but we focus on the specialties to strengthen our commitment to, as Kathy said, our minor services. We serve minors throughout the state of New Mexico and this entire region. and having Dr. Christine Lopez here with gerontology and as the medical director for our long-term care facility, that's been a tremendous addition. Thank you very much. He was not able to make it, but Dr. Akshay Sood is a national leader in pulmonology for occupational health for our miners, and he is a direct partner with us out of University of New Mexico. So I just want to acknowledge Dr. Sood and all of his wonderful work. So, as I said, the clinic is another step in our commitment to enhance health and wellness and access to care for everyone that we serve throughout the state of New Mexico and this entire region. But MCMC will not rest. We pledge to continue identifying health and wellness needs of everybody that we serve. This does include restarting our oncology clinic August 12th. I do want to thank Darlene Longbine, who got certified in biotherapy and will get our oncology certification, along with Dr. Bagwell for that clinic. Thank you, Darlene. So this clinic allows us to move forward in other specialties, from cardiology, urology, dermatology, podiatry, and orthopedics. Within the hospital, we are strengthening our acute care to advanced hospitalist programs. Also, we will be building and enhancing our swing bed program to serve the entire region and all miners throughout the state. So ultimately, I really want to express my gratitude on behalf of the 240 MCMC team members who want to provide you and your families with exceptional care and services every single day. Our pledge is to make a positive difference. And thank you for trusting our family to trust or serve yours. Let's go on and see the clinic.
Well, you left what